Omlonti is a prescription eye drop used for the treatment of glaucoma and ocular hypertension. Indications. Omlonti is used for the reduction of elevated intraocular pressure in patients with open-angle glaucoma or ocular hypertension. Ocular hypertension is a term used to describe elevated pressure in the eye. It can lead to glaucoma and vision loss if left untreated. Glaucoma is an eye disease caused by a fluid built-up behind the eye. It can cause damage to the optic nerve, which can lead to visual field loss and blindness. Open-angle glaucoma is the most common type of glaucoma. It is caused by a blockage in a special membrane, trabecular meshwork, that prevents the aqueous humor from draining out properly. How to use. Gently shake the bottle prior to administration. If more than one topical ophthalmic drug is being used, the drug should be administered at least 5 minutes apart. Contact lenses should be removed prior to the administration of Omlonti and may be reinserted 15 minutes after administration. The recommended dosage is 1 drop in the affected eye once daily in the evening. Contraindications. You should not use this medicine if allergic to omidine isopropyl. Tell doctor if you have ever had swelling or infection in your eye, retinal detachment, or eye surgery or injury affecting the lens of your eye. Omlonti may cause a gradual change in the color of your eyes or eyelids and lashes. You may also notice increased growth of thickness of your eyelashes. These changes occur slowly and you may not notice them for months or years. Color changes may be permanent even after your treatment ends, and may occur only in the eye being treated. This could result in a cosmetic difference in eye or eyelash color from one eye to the other. Tell doctor if you are pregnant or breastfeeding. Precautions. Medicine used in the eyes is not likely to be affected by other drugs you use, but many drugs can interact with each other. Tell each of your healthcare providers about all medicines you use, including prescription and over-the-counter medicines, vitamins, and herbal products. Omlonti side effects. Get emergency medical help if you have signs of an allergic reaction, hives, difficult breathing, swelling of a face, lips, tongue, or throat. Stop using this medicine and call doctor at once if you have eye swelling, redness, severe discomfort, crusting or drainage may be signs of infection, vision changes or red, swollen or itchy eyelids. Omlonti can cause color changes in your iris or eyelids and may change the length and color of your eyelashes. Common side effects may include eye redness, sensitivity to light, blurred vision, dry eye, installation site pain, eye pain, headache, eye irritation, visual impairment.